Welcome back to The Pulse. Now, let's discuss something that will interest you. Radon gas. Radon gas, a naturally occurring radioactive substance, is emerging as a serious health threat in Ghana, with experts warning that it could be contributing to rising cases of lung cancer. This invisible, odorless, and tasteless gas produced by the decay of uranium found in soil, rock, and water has been identified as the second leading cause of lung cancer globally, after smoking. However, in Ghana, the issue has become partially alarming due to the country's unique geological makeup. Recent studies have revealed that certain regions of Ghana have alarmingly high radon levels, particularly in areas with uranium-rich soil. Experts say that these levels, often undetectable without specialized equipment, are posing a significant health risk, especially in enclosed spaces like homes, schools, and workplaces. We're joined by guest Professor Stephen Inkum, Deputy Director, Radiation Protection Institute, Ghana Atomic Energy Commission, and also Professor Francis Otu, Manager, Radiation Protection Training and Consultant Center, Radiation Protection Institute, Ghana Atomic Energy as well. Thank you, gentlemen, for joining us. So I heard the name and I said, what in God's given green earth is that? Professor, I'll come to you first. Okay. Tell me exactly what radon gas is. You're actually teaching me how to pronounce it correctly. Radon gas.
Yes.
What is it exactly?
Radon gas is also a form of a gas. We call it air. But this particular air doesn't smell. There's no color, no tasteless. But then it's formed part of the soil, like we said, rocks and water in the form of concentration, of which at that particular time, it doesn't come out as air. So what happens is that it's formed from a parent we call uranium-238.
Okay. So
when uranium-238 is decaying, like for example, it's pregnant with radon. So when it's giving the babies, and that babies come in the form of air, which contain a certain particles. So in the air, so that particles, when it contains, then we inhale it. So when you inhale those particles, we call it polonium and lead. And those polonium and lead are interested in our lungs. So when those particles, we inhale it, it goes straight into our lungs.
Well, Professor Inkum, tell me, so I've just also learned uranium, and it would rather be a term that, unless I'm in contact with professors like you, I won't be speaking it easily. Tell me, let us have a little education from that one, then we'll come back to the radon gas and why you think it's becoming alarming.
All right, so thank you so much, and a good afternoon to you and then our viewers. So it's a radioactive material which emanates from the earth crust. So when we say it emanates from the earth crust, we have to mine it. So it's below the earth and it's mined as an ore. And for any radioactive material, it must decay or disintegrate, as my colleague Professor Otu indicated, in order to be stable. So in the process of the disintegration, it will emit energy and particles. And radon has been found out to be one of them, which emanates from the uranium. So uranium is like a parent, what we call a parent nuclide. And if it breaks down, and then it gives off particles and in the form of energy, and radon, which is a gas, as he indicated, is odorless, colorless, is one of them, which emanates from the earth crust.
Professor Otu, why should I be concerned with this radon gas?
Yes, we should be concerned because, like Ahmed mentioned from the beginning, it comes in the form of particles. And in radiation, we call those particles as an alpha particles. So when those alpha particles decays, or when it's decaying, it becomes excited. So when it's becoming excited, it releases a lot of energy. And with those energy goes straight to our lungs in the form of radon. So that energy becomes, when they release a lot of energy, that energy is in the form of radiation.
Okay.
And those radiation get into our lungs. So when they get into our lungs, the body will use it. But when it's prolonged or keeps getting it, the lungs becomes weak.
So as I'm speaking to you now, it's possible that radon gas is in the air that I'm breathing it, or does it have access to buildings?
Yes. So the question is, how can it get into the buildings or homes?
Yes.
So sometimes there may be a crack. There may be other walls in the foundations and other openings in the room. And because it's a gas, it will pass through such openings and get into your room.
Interesting.
Yeah, but however, it becomes more serious if in case it gets there and there isn't enough ventilation to diffuse the radon that has accumulated in such an enclosed environment.
So regardless of the ventilation, how long can it stay in that building?
Yeah, I think it's even with the ventilation, what happens is that the ventilation should be in a way that it's ventilated, which is circulating. We should have external air coming to the room and room also going out. So if you have a good ventilation, it moves. But once it moves, it will still emanate from the soil as long as it stays there. So, but then what my prof also said is that if the room is not properly ventilated, just one air will not stop it because it gives some build up. So if you open your window for some times, this air goes out. Once you close it, it also builds it up again. So what?
Never ending. It's never ending.
Yeah, it depends on our lifestyle. And now we can see how now some people are burdened, especially when you become an average person, like some of us, we build one room, we put on conditions, and within a week, somebody will not be open, it's a room. So,
Professor Nkum, this clearly now is a public health concern.
Yeah, definitely, because according to the World Health Organization, lung cancer, and when people talk about cancer, when a cell grows uncontrollably, then that is what we call cancer. And it can happen in any part of the body. And lung cancer is, has been, according to the World Health Organization, is the leading cause of lung cancer is smoking. Next after smoking is radon, prolonged exposure to radon. So clearly, it is of a public health and emergency issue.
I want to stay alive. I don't want to have cancer. And obviously people watching us as well. So Professor Otu, you want to tell us how we can, you've mentioned ventilation, but again, if there are any measures that viewers watching can put in place so that, I know that cancer on itself, you really cannot control it. But it looks like the behavioral patterns of people can help, manage it. So Professor, please help us.
Yes, thank you. Before I go that, I have to mention that my colleague mentioned something about the smoking. And with the smoking and radon, what happens is that there's an artificial radioactive, which also is one part of the smoke. So if you smoke and you stay indoors, then we call it risks. Your risk of developing lung cancer is higher than somebody who only stays indoor or somebody who only smokes.
Okay.
Yeah, so when it comes to the measures, now most of the measures that we have structures already exist.
Okay.
If you go to Europe, they have even limits for old structures and that of the new one. So for now, already some structures are there. If we want to measure, we have to know that. But what happens, some of the control measures that we can have, for example, those are putting up structures, and especially the estate developers, is that one, we need to test the soil and find out if you need the test, it can advise us even where you should position your windows and what type of structure do you have to build. So if those people have been to the ridge, not other places, you can see that they even raise holding structures over there. They have raised the structure in such a way to not touch the ground.
Right.
So when it doesn't touch the ground, the radon which is coming from the soil due to the air, whatever, can reduce the level. So coming out will be a little bit lesser. So one, how to build the structures, and also the soil should be measured.
Okay.
So when you measure it, I don't think...
finally, Mr. Nkum, tell me, is there any stakeholder forum? Is there any activity happening so that we're able to get more education?
Yes, we just finished one yesterday, and I think our discussion today is a follow-up.
Okay.
So the Ghana Atomic Energy Commission was established in 1963, and it advises the government on the peaceful uses of nuclear techniques for research and development. So yesterday, as part of the 60th anniversary, we organized a stakeholders forum where we wanted to create the awareness on radon. Because in other jurisdictions like the United States, for instance, January is set as a month where there is a call for action on radon. And in the United Kingdom, they do that in November. So GAEC, in collaboration with stakeholders such as the Minerals Commission, the Nuclear Regulatory Authority, the Ghana Geological Survey Authority, the Ghana Real Estate Development Association, GREDA, and other Minerals Commission, Environmental Protection Agency, we came together yesterday in order to create this awareness and also call for action of the need for us to have some radon awareness in this country. And what is this call for action? This call for action means that we are calling on government, we are calling on industry to support research, because at Ghana Atomic Energy Commission, we have some capabilities in terms of equipment and personnel.
Okay.
They will need more to step out to carry out this assessment of...
I'm certain we'll have this conversation again, professors. It was a pleasure talking to you, Professor Inkum and Professor Otu. Thank you so much for joining us.
Thank you too.
Now we know what radon gas is, and so you stay safe. But kindly stay with us. We'll take a quick break. We'll be back shortly.